Welcome to The Lens, hosted by Catalysis, where we get a glimpse inside healthcare organizations that are transforming to a culture of improvement to deliver continually higher value outcomes for patients, staff, and communities. Visit createvalue.org/The Lens for more information about Catalysis.
Thank you for tuning into The Lens. I'm your host, Peter Mariahazi. Many news headlines have been highlighting the fact that the U.S. is not vaccinating as many people per day as they had hoped. There are a myriad of reasons. It often comes down to a lack of planning, poor processes, and the flow of the vaccines into the hands of those who administer them. But the good news is there are many healthcare organizations out there who are well-versed in lean thinking and problem solving that have created processes to achieve the necessary goals for vaccinations administered per day. One of those organizations is Salem Health in Oregon. Today, I'm joined by team members, Pam, Reznicsek, and Whitney Diaboy from Salem Health to talk about their vaccine clinic and how they're using continuous improvement methods to meet and exceed their goals for getting their community vaccinated. Thank you both for joining me today. Well, will each of you introduce yourselves and tell us about your role at Salem Health and your role in the development of the COVID vaccine clinic? Pam, why don't you kick us off?
Okay. Hi, I'm Pam Reznicsek. I am the Kaizen Learning and Development Consultant here at Salem Health. And I've been here at Salem Health about almost 17 years now, working primarily in the registration department, and worked my way into leadership and now into the Kaizen promotion office. And I assisted in the COVID kind of post-vaccine clinic, really in the problem solving, along with the revenue cycle teams that really help develop their processes. So now that this is going, how do we bill, and how do we actually implement streamline registration and those types of things. So that's kind of my expertise. I also actually worked at the vaccine clinic doing registration and training. We brought on the National Guard so that we had more hands on deck to kind of help through the process. And that's kind of my assistance there with the workflow at Salem Health.
Whitney, how about you?
Hi, my name is Whitney Diaboy. I've been with Salem Health for the last 10 years, and I've been the manager of our Kaizen promotion team for the last 2 years. I was very excited to get the opportunity to help design our clinic flow, both internally for our employees and how do we actually get our own staff vaccinated, as well as how do we then replicate that out into the community so we can really start to vaccinate our community members as well.
Thank you. Whitney, since you were really instrumental in setting it up, can you walk us through the process at a high level, and then maybe, Pam can kind of help close it out?
Absolutely. So what was really innovative and really supported the ability to get a clinic up and running within 2 days was that our lean office partnered with our HICS structure. So we actually activated an incident command where we had our incident commanders, we had section chiefs, including planning, operations, finance, all of the above, right? And we were actually able to assign, we were called scribes. We actually have a lean person in our office tied to each of the different sections. So that way they can really start to help each section design their piece of the COVID vaccine clinic puzzle. So I was tagged in with planning, and our goal was to design a workflow that could accommodate 2,000 plus vaccines administered a day. It was kind of funny. We weren't given a location. We didn't know where we were going to be doing this. We didn't know if we would have Wi-Fi available. So Epic may not have been an option, our electronic medical record. But they said, high level, start designing what this vaccine clinic could look like. From there, it was actually kind of fun. So we, I think within 1 day, we actually found out we had our state fairgrounds available to us. We still didn't know if we'd had Wi-Fi. So we had to think very quick and crude. What is something that we could create that could move people through, about 2,000 plus people through in 1 day? We made process maps, lots of visuals were included in this planning process. Our goal was to really just keep it as simple as possible. How do we move people through where the process actually tells the people where to go, and it as simply as possible as well. So I think there was a lot of great learnings that we had along the way. Again, when you start out quick and crude, we actually started with paper. So everybody was signing paper consent forms and paper COAs and all of these types of paper things. Of course, that creates issues on the back end of how do we actually start to understand when are they due for their second dose, because nothing's in the medical record at that point.
Excellent.
Yeah. What was great is we were able to then start that quick and crude. We had paper signs up even because we weren't sure the exact flow just yet. So when we opened the clinic that day, we had everybody on paper, and then we started to just quickly check and adjust every single bit in the beginning. So we knew we didn't have a perfect flow because we designed it within 48 hours or less. And then we were just kind of gave ourselves the grace to basically say, all right, we're up and running. We had a test population of about 500 people come through, where we were trying to just understand where are the hiccups along the way. And then we just quickly checked and adjusted. We actually that first day identified those that had mobility challenges. How do we accommodate for them? So that wasn't something in our original design because we were just trying to think high level, 2,000 people. So that's when we started to create, okay, well, maybe there's like a fast track pass where we can bring them kind of through as quickly as possible so they wouldn't have to stand in a line. We also created the fragile population where they would come in through a whole separate entrance and have their own station available to them. So that way they didn't have to commingle with kind of more general public. So it was really, really great to be able to have that HIC structure and that partnership to really harness different leadership roles around the organization to really use their expertise and how to design something that was quick and crude. And then everybody was just in that mindset of how do we just check and adjust as quickly as possible so that we can just be fluid throughout the entire process.
Thank you, Whitney. And I love that phrase, quick and crude, because then that gets handed off to Pam to get it to smooth and easy, right?
Yes. To Whitney's point, we had the paper process, right? So first day, maybe, I think it was actually a little bit further than the first day, we were doing paper registrations, right? So there was some concerns about how do we get the records? How do we get the reporting done? We need to get this into the electronic health records. So now what do we do? And so that's where I was kind of pulled in with the revenue cycle team. And again, just actually pulled in by the VP of Finance, saw me in the hall. Hey, we need to do some problem solving around rev cycle with this vaccine clinic. Come with me. And so kind of away we went. And through that day, we kind of did a lot of problem solving. The team was working very hard to get those registrations in there. The HIM team on site, like scanning in the documentation so we could have those records to be able to send out for reporting and make sure that we got all of those things going. And then really just thinking about, okay, now that we know a few days in about how many people are coming through, now how do we start planning and streamlining the process? So I actually helped probably within the first week of vaccinations. We were full steam ahead, right? We were seeing, over 2,000 people a day. The governor's like, we need to keep moving. Oregon at that point, when we started our clinic, was about 25% of the vaccines that we had received as a state were actually given in the states. And so there was a concern that we might actually lose those because, they do have a time limit for storage and things like that. So she partnered with us as well as Marion. So Marion County has been kind of our partner from the launch. And we got resources from the National Guard to actually help even continue growing. And so that's where I came in and was helping with, now that we have the National Guard, how many people do we really need to have for this flow? So doing some timing. We have kind of two registration flows, right? So we've got one that we're really encouraging the community to do where you can sign up for MyChart, schedule it ahead of time, get all your documentations done, comes in, you're about 3.5 minutes and away you go to your vaccine. Versus our other workflow where people don't want to start the MyChart, they're doing paper, basically handwritten paper that we enter a full registration into our system. Takes about anywhere from 10 to 15 minutes for those full registrations. So how do we manage the flow between those two registration flows, right? So on average, how many people are coming in. So we could actually take the numbers and kind of plan out the staffing for the registration team based off of the cadence of check-ins and things like that, so that we knew how many from a scalable perspective, if we were to say now do 3,000 people, how many people would be needed. Whitney was doing similar work at the same time around how many people we needed to vaccine versus watching, and we had multiple different roles that we had within the clinic. So that's kind of how we help support it. And I would say that one of the key things was replicating the clinic kind of workflow. Like we had started our own internal vaccination clinic, and we vaccinated our organization very quickly. So I would say for others thinking about that, you have a flow that is in existence if you're vaccinating your people. So there is something there that can actually be used as a model for others. So though we stood up the thing in 2 days, we kind of had a structure that we had built, I would say maybe in 3 or 4 days, just for our own team that we had been using for 2 weeks and also revising. So again, it's really starting something, to Whitney's point, directionally where it needs to go. And then as you build the structure, you can kind of check and adjust. And I would say it's continuing to check and adjust, as we go. So.
Thank you, Pam. So
Yeah.
you kind of teed up the next thing. So I'm going to ask each of you to kind of just give us, if you were starting this process now, or you're working with a whole new organization that hasn't done this yet, give me the top 2 or 3. Obviously, people can only absorb so much at a time. 2 or 3 considerations that they need to consider in developing the process. Whitney, what do you think? What's the top 2 or 3 things they really need to think about?
I think what really made ours successful was that partnership with the HIC structure. So having those different leaders throughout the organization with their different expertise at the table, helping with their lens to help design what this could look like. I would also say, we need to vaccinate quickly. So how do you remain as quick and crude as possible until you get kind of an understanding of what the flow could be like, but as you're checking and adjusting, and then you can really start to move into what does S&O of this process look like.
Great. And Pam, what are the top 2 or 3 things you'd tell somebody who's just about to set it up?
I would echo the quick and crude. I was thinking keep it simple. So, a full registration, I would say the full registration here at Salem Health, we get a lot more information. So what are the minimal things that we actually need? So really thinking about what you need in the workflow and just look at the bare minimums and start there. Because when you start with the bare minimums of like, what do you need to actually deliver the vaccine and meet all the things that are needed for the vaccine, and then build upon it. Because once you're using the process, you're going to learn and evolve. I would say it really speaks to our lean journey in Salem Health that we, like frontline staff and leaders, it's not just a few people doing this planning. It's literally everyone who's working in the workflow is checking and adjusting and problem solving as they work. So those are my kind of 2. Like,
great, excellent.
Bring your people in.
Yep.
Go ahead.
I was just going to say, so Whitney, you kind of talked a little bit about starting the process and doing, process mapping and bringing the various people together that are expertise. So anything else you can think of that just got you started and getting the thinking going quickly?
What was really great was we actually had a very, very high level process map, right? So we need them to somehow get their paperwork, and then somehow, there was a conversation of, okay, well, where do they fill out their paperwork? And they were like, well, let's give them a pen and they can do it in the car, right? So we just had a very, very high level. And then once we identified our space, we had a printout of our process map and we actually took it there. And we said, now let's walk it. How would this actually physically look in this space? So that was really instrumental. We did that on like day 1, design, day 2, walk it, and day 3 is the day we launched. So that's where it was just a matter of, we didn't overthink it. Like I said, we didn't even think of like, oh gosh, people with mobility challenges, how do we accommodate? If we had spent all the time on Monday baking in all of the what if scenarios, we would have never been able to launch. So that's where I would say that walking the space, and then that afternoon, so it was a Tuesday afternoon, we actually started being like, okay, well, if this is going to be here, let's start, putting tables out so we can really start to visualize it. And then again, we had every single section chief from our HIC structure, whoever was on that week, present, so they can, like our safety officer was thinking like, okay, well, if this is where the tables are going to be, and we're going to have people walking this distance, how do we make sure that they don't trip over something, right? So she kind of had her lens going of what would make sense as we're designing. So while we had a high level visual, what really made it important, and I really think this enforces the concept of go and see, is we were designing it while we were seeing it. So since we didn't have the people on site yet, we were able to kind of, well, let's move this table back here. And what if we had kind of the line move this way, and then we can move this table over here. So we truly were just, we had again, that high level thought in our minds, but we were able to just design all together as a group on the site, which is very, very valuable.
I think it's great that you started the process before you even knew which space you were going to end up with. I mean, that's what's, to me, very intriguing, is to say that. And so anything, Pam, you can think to add regarding starting of the process? I know you kind of came in a little bit downstream, but.
No, I think Whitney covered most of them. I would say that, once things are kind of, they've got their flow, we've created standard work on things, right? So there's standard work for people doing vaccines, standard work for people who are, drawing vaccines ahead of time. So we have people who are preparing the vaccines and kind of distributing them out. And then visual management. Great. And I would say, again, in the background, the incident command structure is really keeping track of data, right? So how many people are flowing through, what's our supply look like, how do we need to check and adjust? So it's a system in the background that's informing the flow in the actual operations.
So give us a couple of the challenges you faced along the way. What are some of the things that you went, oh geez, and it really kind of caused you to, sit down and need a cup of coffee?
At the beginning, when we were doing so many quick and crude changes, right? So we're like, oh gosh, we need to set up this, we need to do that. It was hard to keep everybody informed of all the changes. So it really reinforced the concept of like a visual quick and easy board of some kind, or even huddles, right? So how do we kick the day off? Like, okay, guys, these were the changes we made yesterday. This is why they were changed. Keep in mind, if you think of more great ideas, put them over, right? Those are some of the things I wish we thought of it at the moment. Some of our basic lean principles, right? So that communication breakdown was visible every single day as we were like, oh, crumbs, yep, that didn't communicate it to you. Let me get you up to speed, so that way we don't stumble over the same stumbling blocks we did yesterday, kind of a thing. So I would say to help prevent some of those communication barriers, absolutely making any of those kind of quick and easy ideas visible. And then how do we include it in a huddle? We eventually did institute something to this degree. It just took us a good 5 days of stumbling every single morning, like, oh, crumbs, before we finally got something in place to actually. But to have that in the beginning would have been much better, much smoother.
So Pam, other than them having to use paper forms, what were some challenges you experienced?
I would say that was kind of the big thing is oftentimes revenue cycle, like everything happens, for the patient while they're in-house, and then the revenue cycle is obviously an afterthought. And being someone who has come from the revenue cycle, I get that. But I think the benefit we have, and even though, like to Whitney's point, though there were things that were missed and things that may have been changed, I think our team has a lot of grace with one another. To know that we're doing this for our patients, and it's really about getting them vaccinated. Like, we care about our community, and so we're going to do what we need to do in order to care for them, and then we will do our best to figure out how to make it, because we know that it's not going to be perfect straight out the gate. And I think that through all of the incident commands that we've had from COVID, we have learned that it is not going to be perfect right away, but that we will come together and we will problem solve and use our tools to actually make it better. And so in the end, hopefully to produce something that others can then replicate and not have to stumble nearly as much.
Excellent. So in retrospect, you kind of look back on, the quick and crude, right? Whitney, what was the one single biggest learning that you got as this process rolled out? What's the one thing that jumps out to you?
I think it's really impressive how much our organization can do on a short timeline. If we're given the goals, it's amazing how people can come together and design quickly and deliver something. I don't think we ever thought, 5 years ago, that this would ever be a reality where we can, where our organization is used to lean to the point where we're like, hey, let's just quick and crude put something together. Let's process map this. Let's make a visual, right? So I think it's my biggest learning is just how great it is that we can, if we challenge ourselves, if we push ourselves, we can actually do so much in such a short amount of time. And it's such a great outcome for the community. Absolutely.
That sounds like it's a real testament to culture, right? The culture of the organization lays the foundation, and then whatever the world throws at you, you guys are together to handle it. So, Pam, what's the single biggest learning for you?
I would say learning how though we talk a lot about the HIC structure, I would say the way we do our hospital incident command structure may look a little bit different because it is kind of a standardized thing, but our lean principles have allowed leaders to kind of make things their own. So like the planning section chief, those teams can actually develop and build things that are important for that team. What is that visibility? And so though we give structure, oftentimes we use our lean thinking to make it work with, and I think that's one of the things that was an aha moment for me in this last year, and just working a lot more with incident command, is how much to Whitney's point, how much we can do when we actually come together and use our lean thinking and that kind of structure of like, making things visible, walking the processes, going and seeing, creating visual management and standard work around things. Like, we do it very quickly. And so how do we now, though we can do something as big as this, how do we now apply this to our organization? And I think that there's some great learnings that we can do from this as we continue to grow our lean culture at Salem Health, for sure.
That's a wonderful observation. So, Whitney, you get a phone call from somebody across the country. What advice do you give them who's still developing their vaccine process?
I would say don't overthink it. Just try something. Start with something and start running and seeing where it goes. If you start overthinking it, you think of, again, all those what if scenarios, and you're spending too much time designing and you're not getting vaccines in arms, right? That's the ultimate goal. So how do you do that as quickly as possible? So if you're overthinking it, you're slowing yourself down, and just, you need to start with something and just start running.
Ties to Pam's keep it simple, right? Just, progress over, paralysis. So Pam, Whitney's just finished giving that advice, transfers the person to you. What do you say to them to give them advice?
First, Whitney's advice is great. So definitely take that into consideration, because it's about continuous improvement, right? And I think at this point, a lot of healthcare organizations, you are doing vaccines within your own walls. So how do you now take it a little bit further and challenge yourself? Again, we took a big challenge. We were like 20, or, we were like 2,000 a day. Doesn't have to be that big. I think we can probably move this needle quite a bit, even if we're doing smaller challenges. But if most healthcare organizations are just kind of taking that leap to say, how can they now support their community and the people out there that they're caring for, just a little bit, take what you've learned and improve on it a little bit. And over time, we will have everyone vaccinated, in a short order. So.
Great. So as we kind of start winding down, Whitney, any final thoughts you want to share with our listeners?
I would say this is a great opportunity to start thinking about, so we've been open and operational for about 3 weeks now, a little over 3 weeks. And so now we're in how do we start handling second doses and more people, right? So we were vaccinating 2,000 plus up to 3,000 one day people. So now we're still anticipating 2,000 people coming through, plus the 3,000 second doses. So how do we now have a scalable model that can get up to 5,000, 6,000 doses a day? So really thinking through what's that scalability. I know Pam's been talking a lot about ratios, right? How many registrars to how many vaccinators? So really kind of stretching our thinking in that way, as well as what does S&O of this look like, right? We can't have our HIC structure and every single lean team member out there every day for the next 9 months, or however it might take until everybody in our state is vaccinated. So that's where we really had to start thinking of the permanence, who is truly going to be that operational director over some of this work. And we now have kind of spidered out into different clinics and things like that. So who's the ultimate kind of person over this now that we're standing down our HIC structure in our incident command? And then who are those kind of interim? And all of this has to be interim because we're not going to have a vaccine clinic up 5 years from now, I hope. So who can we kind of start putting in place and really start to create that structure where there is a hierarchy, where decisions, and they can get more of the sustain and operate type huddles going more efficiently. Quick and easy boards. How do we create more strategy deployment visual management boards, right? Where these are our key metrics and how we're doing each day. So that's where our next kind of focus is going, is how do we handle first and second doses flowing through our clinics, as well as how do we start getting more of that S&O structure, so that way the rest of us can try and start getting back to some of our other responsibilities.
Thank you. Pam, any final thoughts you want to share with the audience?
I would say, for us, we've had some barriers with, lack of vaccine too. So I see that that's probably going to be something, with bigger structures like that. So don't be surprised if some of those things happen. So, we're flexing our model as we go. So keeping those things in mind. And then again, for us, yes, like the incident command structure pulls a lot of our leaders. So most of our executive team is involved in a rotation. Actually, all the executive teams are involved in a rotation, as well as all of our directors. And so, that is pulling from operations. So it's very important for us to, now that we've got this running and we know that we've got a process, how does this become its own operations? And then we can now focus back. So we're kind of doing that transition now on how we get back to just kind of regular operations. And the clinic has its own leadership and sustainment moving forward. So.
That's excellent. That's a great way to kind of close it out. So thank you both for joining us today. And really appreciate you sharing the work on COVID-19 Vax Clinic at Salem Health. For our listeners, please visit our COVID-19 resource page at createvalue.org to find more information and learning about navigating around the COVID-19 pandemic. There is also information on YouTube specific to the Salem Clinic. Stay tuned for more episodes designed to help healthcare leaders support their organization on a journey to operational excellence.
Thank you for listening. Visit createvalue.org/thelens to learn more about how Catalysis can inspire you to accelerate change in your organization.